It's December 21st, 2021. This is Dr. Dan Kurlinski giving a little more update on post-COVID fatigue syndrome. We've been battling pretty good with percussion vibration to the rib cage, helping loosen the lungs. And it helped show us how to take the pressure off of the frontal bones in the skull. And then we proceeded to find the tightness of spike protein induced adhesions in the pericardium, and then falling from the pericardium onto the four chambers of the surface of the heart, a sticky glue material that was affecting the pattern of atrial and ventricular contraction. We then found at the back of the skull a lymphatic drainage going down behind the cervical spine, a new location for lymphatic drainage discovered by Alzheimer's researchers. And in the last month, we've been impressed by the large amount of demyelination, myelin mixing with this lymphatic fluid and dripping down the back of the neck, causing rather large swellings of lymph material. Then what we began seeing from this delta phase as the months went on is patients who hadn't been coming in or people that we hadn't worked on before were getting adhesions that were tighter and tighter, changing the shape of the base of the occiput and hardening on the inside of the lungs to the point that we couldn't get it free with simple percussion. So about 3 weeks ago, we added in using nebulizers, so both albuterol, a bronchodilator, and the steroid that's been used to be able to loosen up the lungs from the inside, to be able then to put the percussion on the outside and make some progress. All that sort of came to a rather abrupt change as we've been hit by this third powerful viral variant, the Omicron. Omicron is very, very different. Number one, it hits the liver hard right away. What was interesting about COVID and Delta was that the liver was somehow missing that this infection was working its way cell by cell, not exposed to the bloodstream. And people would have stiff rib cage for a long time, and maybe a month or two later, the liver would get hard. So we'd have to release the liver, and another treatment after being able to get and keep the lungs open. But Omicron hits the liver right away. It's a big, swollen, tender, nauseating liver swelling that confronts us right away. And again, the head is also affected, but what's very, very striking is that we've seen a number of cases of just half of the head, the left hemisphere, more frequently is swollen by this new coronavirus variant and demyelinated. So the left hemisphere goes flat and dry from the front all the way to the back. There's some, demyelination and lymphatic sort of collection in the neck, but what's profound is how flat the entire left hemisphere is going. That's something new. And so we're going to have to find a different therapy to try to make progress with that. We've been looking at trying to locate sphingomyelin, and we've located what we used to call a glandular, sort of a preparation of grass-fed beef brain, and so it's going to be very interesting to see if we can restore what's being lost. The entire left hemisphere means we've lost our language ability, our logic, our ability to communicate, and make a plan together. And you can sort of see, looking around our country, we have lost that ability across our society. And we'll see if finding elastin, the thing that keeps our lungs elastic, and the thing that lets our collagen all over the body be able to flex and be able to move, if using elastin, which we found from grass-fed beef lung, freeze-dried capsules is going to be able to help us fight back against the stiffness in our collagen and the stiffness in our lungs as we go forward. In some ways, it seems that the change in the spike protein has set up this new variant to not be as tight and sticky, to not dry as hard, as the Delta variant. We were sort of pleased in the beginning, early in 2020, mid-2020, when we could just shake what seemed to be spike protein polymers, loose, salt bonds, hydrogen bonds, relatively weak bonds. That changed with Delta as things got harder. We went from like gel, like rubber cement, to dried Elmer's glue, and then it started turning into something that was as tight as epoxy. And we know the spike protein creates adhesion glue molecules as tight as our tightest junction in the human body. So we were dealing with a very, very difficult glue. It does not seem that Omicron is going to be that tight a glue, but where it's hitting, liver, and one entire hemisphere of the brain, makes it look like we're looking at another very profound and a different sort of threat to human society. So everybody do your best. Remember, rub the back of your neck, the back of your head, pat everybody on the back, rub their heads, keep feeling, keep your hearts open. It takes a lot of work. We can do it. But it's going to take bridging that gap between people so that we can actually do what's needed physically, because there's a biophysics of this illness where we can fight back and be of good spirit, and let's do it.